too. Okay. Good evening and welcome. Thank you guys for being here. I am Angela. I'm with Young Living Essential Oils, and tonight we're going to be talking about our health share and the partnership that Young Living created with Clearwater last year as a way to help people to have a opportunity for more cost-effective healthcare that is a little bit different than traditional health insurance. So thanks for joining me. I learned about this a little over a year ago, actually. And at first, when I heard about it, I thought it was too good to be true because I always had traditional health insurance and that. But once prices for health insurance, because we own a roofing company as well, so we're responsible for our healthcare and paying that bill, even the part, we pay part of it, our company pays part of it. But when the price was going to go up again, I was just like, oh my gosh, I have to look into other options. And that's what made me start looking at this. And my family now saves $600 a month and has better health care. So we're a family of four, we're in our 40s, and I'll get into kind of the details of that. And I'll even share on a screen a little bit later some of those specifics. But that's what's leading us to be here tonight because I started diving in and learning. So then I was like, okay, I got to start sharing with other people to help people see the benefits of this. So, what is Clearwater? So, Clearwater is a healthcare provider and they are a nonprofit business. I'm going to talk a little bit about the differences of traditional health insurance and a health share or this healthcare program that they offer, that they were established in 2018. So almost 7 years old, coming up in a couple of months, be 7 years old. It's not traditional health insurance, but it's an option that covers both medical and holistic coverages. That's one of the nice benefits about it. With them being a nonprofit, what that means is that if you're familiar with nonprofits, there's a limit on how much profit they can have or how much money they can make. There's a big difference between this and traditional health insurance because traditional health insurance, if you know anything about it or you've ever worked in healthcare, I have. I spent 12 years in healthcare. The goal is to make as much money as possible. So people are doing like in the healthcare industry, they're doing everything they can to make money. And in health insurance specifically, that is the case. So the reason that Young Living partnered with Clearwater is because they were a wellness company, and we wanted to be able to disrupt or start making changes and shifts in America and what people are traditionally used to. So it's allowing us to put healthcare back in our own hands and take control, really. So, what is a health share? So, it's a community of individuals that are paying a monthly premium to help cover medical or holistic expense costs for everybody within the group. And contributions are shared. So we pay in our money and then it gets paid out, and they have calculations to figure out what those amounts should be or need to be to cover the expenses. So we pay an annual max. If you're used to traditional health insurance, you're probably used to a deductible that you have to pay and cover everything until you achieve that deductible. And then you have an additional annual max out of pocket. This, you have one amount. So you choose, do you want to cover on your medical expenses? Do you want to cover the first $1,000, the first 2,500, or the first 5,000? If you're willing to cover more, then your monthly premium is less. So, and I have a screen that shows that and all the detail of it, but those are the options. And then after that, pretty much 100% is covered. So if you have a emergency situation or you have a surgery or something like that, you cover that first portion of what you've chosen. And then after that, that's when the sharing takes into consideration or starts. This screen here shows the differences. So some of the things, like I mentioned already, Clearwater is a nonprofit. Not all health sharing companies are nonprofits. So that's something to be aware of that helps to keep our monthly premiums lower than some other health share companies. Traditional insurance is a for-profit company. The health share has an open network of providers. So you don't have to pull up a list of providers and see if it's somebody you can go to. As long as it is a licensed provider, you can go to them. And the coverage is the same for all of them. Deductibles, again, it's kind of different. You only have one annual max that you're paying, which is similar to a deductible, but there aren't two different amounts that you're paying attention to. With the health share, claims are rarely denied. That's a nice benefit. Again, we want to keep people happy so that more people are paying the monthly premiums to help keep the costs low for everybody. And that's why claims rarely get denied. So, in health insurance, a big difference there is there are actually employees that are reviewing paperwork to deny claims. That's their job, and that's what they're paid to do to help make the health insurance more money. And again, decisions are back in our own hands with who we're choosing for our providers, that type of thing. Does anybody have any questions at this point? No? Okay, cool.
I'm good.
Oh, okay. So this is my family's example. As I mentioned, we are saving $600 a month. So I have a few things here that were kind of the important pieces or parts for us. We are doing medical and holistic coverages. We're in our 40s and we're a family of four. With our traditional health insurance, we had 12 visits a year that we could go to a chiropractor for each one of us. And now that we have changed to the health share, we actually have 24 visits per year, and we can choose to go to a chiropractor or an acupuncture. When I was pregnant with my son, I went to the acupuncture, I think it was 3 or 4 times, and I think it was $155 each time. Insurance didn't cover any of it. It was 100% out of pocket. If I had had this, then it would have been covered and I would have paid the first $35. So something that's very different. Our out of pocket expenses have decreased. And other things that are included is we can now get IV drips. When I go to the chiropractor and get a massage at the same time, as long as it's on the same invoice, that's covered. Telemedicine is included, which is pretty similar. Most insurances are offering something like that or something similar. But the telehealth for mental care is typically not covered on insurance. It wasn't for ours, and now it's covered. It's part of the monthly premium, and it's no additional charge. The nice thing that I love about, oh, I think somebody's in the waiting room. Let me see if I can figure that out. Yes. The nice thing that I love about the relationship that Young Living created with Clearwater is that my family buys essential oils and supplements every month. We're very proactive about our health, and we get reimbursed for $75 of that now. So, in addition to having this $600 in savings, we're really using it a lot more and having a lot more benefit with that. So, I kind of mentioned a little bit that there's the medical side and then there's the holistic side. So ClearShare is what the medical side is. So somebody can get medical coverage only if they're wanting to keep monthly premium as low as possible. They're not necessarily interested in holistic things like chiropractor, acupuncture, supplements, that type of thing. But this would be for more like a major situation. If you have a emergency room visit, if you have a surgery or something large. The holistic part of it is for people who want to go to chiropractor, acupuncture, physician, and you have the ability to go to a naturopath, and you can really take control of being proactive about your health. So that's a really nice thing that I like a lot. This is the holistic side is what gets you coverage for essential oils and supplements, gets you mammograms where you can, again, choose the provider that you're going to. Now, one of the things about this that's different than health insurance is that when you have a pre-existing condition, there can be some limitations. So, if you have a pre-existing condition, you're welcome to share that, and I'll give a couple of examples. But that can be a reason that this might not be a good fit for you because that pre-existing condition wouldn't necessarily be covered. For example, if you are going through cancer treatment or you have been within the last 60 months, that would not be covered by the health share. So you probably wouldn't want to get the medical coverage because you may need to have coverage if something were to happen, or for sure if you're still going through treatments and that. But you could qualify for the holistic side of it. There is no pre-existing condition on the holistic side of it because it's very clear, very cut and dry. The visits you can go to in a year, what's covered, and that type of thing. So it's not going to cover some unexplained or random expense or emergency type of situation. And then the third box there on the far right is you can get both. You can get medical coverage and you can get holistic coverage. That's what my family has. And again, that's what my family has. So we're upgraded and still saving that $600 a month. For the holistic plan as well, this is an option for people who are 65 and older. Again, most of those have Medicare. And so this would be more of an add-on or a supplemental for those people who want to be able to have a lot of freedom and flexibility with their care beyond the basics of Medicare. A lot of people, I think, get like Humana is a really popular one, I think, in our area as their supplemental or an add-on to Medicare policies. So here, what's covered by ClearShare? Again, there's no network. You go to any doctor. If you have an accident, you have an emergency room visit, you're in the hospital for one reason or another, telemedicine, mental health care, those are both online. Care coordination is a specific department at the health share that helps you when you do have something major medical. For example, maybe you need a hip replacement surgery or a knee replacement surgery. You can use this department to open a claim, and they will then help you to determine if the place that you're going is going to be the most cost effective. Example, one gentleman was getting a hip replacement, and he had talked to his doctor, got pricing. It was going to be $80,000 to have that procedure done at the hospital, and he got care coordination involved. They did some research for him and found that his same doctor was able to do or does surgeries at the surgery center where the cost would be $40,000. So the cost was cut in half. And because he used care coordination and then chose to take their advice, his personal annual max was waived for that procedure. So he didn't have to pay anything for that procedure because he saved the whole organization $40,000. So that's a really, really nice feature that when you do have something major, and it's not an emergency, obviously, it's something planned, that you can really save yourself a lot of money. It also covers pregnancy and postpartum as long as you're not pregnant when you get the uh, policy. So that would be considered a pre-existing condition. You can choose to have a hospital birth, birthing center birth, or home birth. You can have home health care, pain management injections, hormone therapy injections, medical supplies, nutritionist services, internal medicine, occupational therapy, physical therapy, speech therapy, massage therapy. As you can see, it's a long list. I'm reading it because I know some people watch on their phone, but hospice care, skilled nursing facilities, durable medical equipment, and weight reduction. So lots and lots of services. There are very few services that aren't covered. Again, it's something that gives you complete control and can replace traditional health insurance. So this shows the holistic coverages. And for example, on Young Living Essential Oils, you can get oils and supplements. And if you're an individual, you would be reimbursed up to $50 per month. And if you're a family, it would be $75 per month. Primary care visits, for any holistic things, you're going to pay for the procedure or the treatment or whatever it is, the product, and then you're going to submit a receipt within 30 days. That's critical. You have to submit the receipt. It's a very easy online submission that takes less than 5 minutes, maybe even less than three. But you're going to submit that, and then you get reimbursed the difference. So if you went to a naturopathic doctor and it was $120, you pay for that, send in your receipt, and you would then get reimbursed $100 because your responsibility for that visit is $20. And you can go to any kind of doctor. You can see there on the right side, naturopath. It can be a medical doctor, doctor of osteopathic medicine, really just about anything. Also, breast imaging is covered. This is the big one. You can do thermography or a mammography. I actually, prior to having this, I went 2 times and did thermography, and it was 100% out of pocket. I paid for it. With this, $150 of the test would be covered. Chiropractic, again, chiropractic and acupuncture on the full holistic plan is 24 visits a year. You can go 24 times to the chiropractor. You can go 12 to the chiropractor and 12 to the acupuncture. Between the two, it's a combined of 24 visits, and it's $35 that would be your final out-of-pocket cost for a visit. Now, this is really important. If you think about it, if you're just going for a normal chiropractic adjustment, it's probably somewhere around $40 to $60. So not very much, but this includes reimbursement of your add-ons. So when I go to the chiropractor, I get adjusted, it's $60. And then I also buy a supplement that's $45. And my chiropractor offers red light therapy. So I can get that. I can get all of that. And my visit could be $210 and I would get reimbursed $175. So the reimbursable amount per visit is $175 plus your responsibility of $35, meaning you can spend $210 and get $175 of it reimbursed. This is how, if your chiropractor offers massage, you can get massage at the same time on the same invoice and have that be reimbursed, or whatever supplements they offer, or any of that type of thing. So, does anybody have any questions on this? Because this is a really, really big one that a lot of people love the feature of this one. You guys are easy tonight. I like it. Also, IV drips, you can go once a month. $100 benefit on that. Prescription medications. If it's a generic medication, it's covered 100%. So it's zero out-of-pocket cost for you. If it is a brand name, it depends, and they do price depending on the cost of it and specific details. So I don't have like a price list of that. Obviously, there's, thousands of medications out there. Now there's yes, go
I
ahead,
actually have
Elizabeth.
a question about the
Okay.
holistic part.
Yeah.
So, say that so I see a PT and then I also get like soft tissue massage because I've been having a back injury.
Right.
Would that fall under holistic or would that be a pre-existing condition?
Um, we could talk about the details of it. Have you been hospitalized for it or on any like medications or anything like that for it?
Um, so no, I wasn't hospitalized or on any medications because my previous insurance actually didn't like really do much. Like the doctor didn't do much. So
Right.
I didn't end up going to PT or anything. Um, so I never went to the doctor much for it. So I don't know
So
if it would count.
were you did you ever go to a medical doctor that gave you a diagnosis of a bulging disc or something of that sort, like any diagnoses, or you have pain that you're simply being seen for?
No. Oh, I actually remember what happened. I couldn't get to the doctor for like 2 months because in California it takes a really ta long time to see the doctor.
Wow.
So yeah, so it took me 2 months to go, and by that time I was already like almost healed because I started seeing a soft tissue masseuse. Um,
Right.
been still seeing him. I never like the doctor didn't do anything because I don't think it was a bulging disc. Would that count towards this like holistic part?
So if you have never received like any diagnosis that's on record, then it
Mhm.
wouldn't be considered a pre-existing condition. So that's why I was kind of asking those questions about
Okay.
that specific. So that's really good to know.
Okay.
So the medical side would cover the physical therapy. So back on here, so the physical therapy,
Mhm.
and I'd have to find out. So, do you go to the physical therapist and have massage, like when you are there for PT and a massage, or how is that?
So I actually haven't like been doing physical therapy. It's now like massage therapy.
Oh, okay,
But I would love to see a physical therapist. The doctor didn't refer me, and so I didn't pay for it. So I'm curious
right,
if this would be an option.
right. So yeah, so the physical therapy would be under the medical side,
Okay.
and then if you found a chiropractor or an acupuncture clinic that
Mhm.
offered massage, then
Okay.
that could be under the holistic side. Now,
Okay.
massage can also be covered under the medical side up to $3,000 in a calendar year
Okay.
after you've met your annual max.
Okay.
So there are a couple of ways. In
Mm.
that case, it does require a doctor to write an order for it. But
Okay.
I think physical therapist is an are they an MD or do they just have a master's
Um,
degree?
I don't
I don't
know. I could
remember.
verify on that, but I just
Cool.
was
But
curious because
but yeah,
yeah.
that's a very good question, and we can dig deeper into that to
Okay.
find out for sure.
Okay.
Good
Thank you.
question. Yeah, absolutely. Okay, so that's the full holistic. And so now the holistic savings. So there's a more basic holistic option that you can get. So a couple of differences here is that you still get the essential oils and supplements coverage. You still get primary care visits and chiropractic and acupuncture, but it's half the number of visits. So instead of 24 visits a year, you would get 12. This one does not cover the prescriptions, and it does not cover I'm going to go back to that previous slide. It does not cover the breast imaging or the IV drips. So some differences, but a nice option to still give you some holistic care and coverage. We found at first we just offered the full holistic option, and we found that people were wanting something a little bit different or a little more basic. And so this just got introduced, I think, about 6 months ago for this option. And now I'm showing the pricing. So here, this is for medical only. So I'd love to know if you would put in the comments if you're looking for coverage for yourself only, and if you have an idea of if you're wanting medical only or holistic. You'd love to share that in the comments as well. So this one, like let's say, for example, Elizabeth, I'll use you as an example since you spoke up. And you'd be in the age group of 18 to 29. And if you're looking for just yourself, for medical only, it would be $195 a month if you were comfortable with a $5,000 annual max. It goes up a little bit as you have your annual max reduced. So you can see the first column is 5,000, then 2,500, and then 1,000. Now, if you're in your 50s and you're looking for coverage for yourself and a spouse, you would be looking in this column down here. So at 5,000 annual max, you would be looking at $465 per month for a premium. I like to kind of pause on these screens in case you need to take a screenshot. I also have them recording, so you can have the recording to rewatch it, or if you need to kind of zoom in on any of the areas and that. Awesome. So that was the medical. This is if you're looking for holistic only. So again, this is somebody who might have a pre-existing condition. They're over 65 years old, or they simply maybe have a good traditional health insurance, but it doesn't cover the more holistic items and options. So they're wanting something like that. This would be for that coverage only. And then if you're looking for a combination, so this would be for the medical and the basic holistic, so the holistic savings that gives you the 12 chiropractic visits in a year, and that this is combined pricing. So again, if you're single, Elizabeth, in your category 18 to 29, you would have, you're comfortable with a $5,000 max for the year, then you would be paying $238 for a monthly premium. And then here is if you're looking for the full holistic plan where you'd have 24 visits a year, you'd have the mammography covered, you'd have the IV drips, and the prescription coverage. You can see that again, same categories. I'll give you just a moment and I'll get the chat real quick. Awesome. So who is iPhone? If you could put in your name, I would love to know. Is that you, Alan? Did you connect on your iPhone as well for being able to type messages?
No, I'm Android.
Oh, okay. So
So
whoever
not
the
iPhone.
iPhone person is, if you would share your name so we know who you are. Let's look. Melissa. Okay, cool. Thanks, Melissa. Melissa, you'll have to let me know where you're joining from and who invited you, because I like to make sure that I know who everybody is because we have a referral program. So I'm thinking it might be Tarina, but if you would put that in the comments so that we can make note of that as well. Thank you. Awesome. Okay, so the annual max. I want to kind of explain this, and this is specifically if you have a family that you're looking for coverage, or there may be families, like for you, Melissa, if you have an employee that has a family that they would be getting coverage for, I like to show this. So if it's only you, the annual max is what it is. But you might have seen on the screen where I showed my family, for a family of four, our annual max on the $2,500 tier is $7,500 among our family. So it's not $2,500 for every individual, because for me that would be $10,000. But For 3 of us, it would be $2,500 or split if something happened, and we all had smaller amounts. I like to show this because it's important to be able to see that and know what that is. Does anybody have any questions on here? Okay. There are options for vision and dental coverages. Again, you can get these individually. Those are the 2 options at top. So vision only, then dental only, and then at the bottom, if you're wanting to have both of them. And for my family, we did we did vision and we kept our old dental because they were pretty similar, but the orthodontic coverage was a little bit better with our old policy. And I think that it was like only a difference of $5 a month that we would have been saving. And I thought, my kids might need to go to orthodontic. I let my daughter have a pacifier too long. So I think she's going to need to have braces and that. So I like to just make sure that I point that out and show that. So how does this work and what are the specifics? So again, this is a partnership with Young Living. So if you already have a Young Living customer account, then it's just using your customer account number to sign up and enroll through Clearwater so that you get the pricing and the discounted package options. So Clearwater administers, and that's who you pay the monthly premium to. That's who you get your reimbursements from. And they are if you have a major medical situation, then they're the ones that are going to be helping you through that. But it's the partnership with Young Living that allows you to get those prices, those discounts, and the specific reimbursements that we were talking about. And then what's the timing? How does it work? You sign up for a health plan. So if you were to sign up in the month of February, now to the end of this month, then your plan would begin on March 1st, or you can choose a month, different later. You could choose April 1st or something if you wanted to, but it always starts on the 1st of the month. And then you get billed for that month on the 10th. So if you joined and had it activated on March 1st, your first premium would be due on March 10th. And then you would be able to start submitting reimbursements and getting paid back. Now, you don't have to wait until the 10th to go to a doctor or get something covered. Your coverage actually starts on the 1st of the month. But I love that you aren't paying in advance. That's something, again, that's different with health insurance. Usually health insurance, you're paying at least a couple of weeks in advance, depending on the plan and the coverage type of thing. And so this is a nice option that you're actually paying after you start getting the benefit. Cool. Any questions? I kept it to 30 minutes today. I like it. So the next steps would be you could email me or you can call me. You can stay after if you have some sort of situation that you want to talk about privately. I don't know all the answers. This is newer to me. I do have a benefits expert at Clearwater that I work with and partner with. She is in Florida, so she doesn't typically come to these classes since we're on the West Coast and that. But I always have access to her and can get answers early the next morning if you have a question that I don't know the answer to.
Awesome. Thank you so much, Angela.
Yes,
Really
thank you.
informational. I appreciate it. Could we get the recording of this? I know that like my company, a lot of the people would probably want to see this for future. So
Yeah, absolutely. I will send you the recording. It will be a little bit later tonight or tomorrow morning that I will send that off to you. And I have the Saturday morning at 10 o'clock still planned. So if you have anybody else that wants to join, we will definitely be here.
And then
Yes.
once we are interested, do we just go ahead and reach out to you through your website or email you back, or what do you prefer?
Yeah, you can just reply to the email where I sent you the link,
Okay.
and then we'll chat and compare calendars. It takes about 15 minutes. You need to make sure you bring your social security number, and just basic information other than that. Social security number for everybody who's going to be on the plan, and we'll get you all set up.
Thank you.
Thank you.
Thank you.
Appreciate you
Thanks,
guys.
Angela.
Thanks for being here. Yeah, thank you, Alan. Have a good one, guys.
Bye.
Bye-bye.